Managing pain isn't about using the strongest drug, it's about taking the right one. Hi, I'm Dr. Amayo, a UK doctor, and I'm going to break down the main pain medicines we use in the community, how they work, their side effects, and when they can be helpful. Starting with paracetamol, or Tylenol if you're watching from the US. This is a household favourite worldwide for doctors. It actually is my personal favourite because it's versatile, it's easy, it's got a low side effect profile. And yes, I know it gets a lot of hate because it's seen as one of the milder options, but it works more often than people expect. So, how does it work? Funny story, despite its worldwide heavy usage, this has been up for debate for ages. What we think now is that it mainly works in the brain rather than directly at the site of injury. It seems to dim down the pain amplifying chemicals and also activate the brain's own pain dampening systems. So instead of switching pain off, paracetamol seems to just gently turn the volume down in more than one place. Now, paracetamol is broken down in the liver, and this is where the main risks lie. Taking too much can cause serious liver damage, which is why sticking to the recommended dose really matters, and dosing is not a one-size-fits-all. Children, people with lower body weight, those with liver or kidney conditions may need adjusted doses. But like I said, doctors like paracetamol because it's generally safe. Most people don't get side effects, it can be used long term, and it's a really good all-rounder. It works for simple pain like mild headaches or stomach pains. It's effective at reducing fever. It can be used alongside other painkillers for more severe pain, although on its own it might not be enough. And the truth is it works brilliantly for some people and much less for others. So it's worth knowing your body and knowing what works for you. On to the next, anti-inflammatories, more specifically NSAIDs, which stands for non-steroidal anti-inflammatory drugs, things like ibuprofen or Advil if you're from the US. These are also very commonly used, and thankfully we actually know what they do. Yay for medicine. Now, unlike paracetamol, which mainly works in the brain, anti-inflammatories work at the site of the injury. When your body's damaged or hurt, say you sprain an ankle or strain a muscle, it releases these chemicals to help with healing. And these chemicals, they trigger inflammation, which is when your blood vessels open up to send more help to the area. That's why inflamed areas become swollen, red and warm. That response is the body trying to help, but it's also increasing pressure on nearby nerves. And those same chemicals also make the nerves more sensitive. So that's what causes the pain. Anti-inflammatories reduce these chemicals, calming inflammation and easing your pain. The trouble is, those same chemicals that drive inflammation also help protect the stomach lining from all that digestive acid that helps break down food. When that protection is reduced, it can lead to stomach irritation, ulcers, or bleeding. That's why we usually advise taking anti-inflammatories with food rather than on an empty stomach. They're also not ideal for long-term use as they can affect the kidneys. Extra care is also needed if you have heart failure, you're pregnant, you've got asthma, you're older, or take regular medications. The key is making sure they're safe for you before starting, not using them long term without advice, checking if you need some stomach protection, and speaking to your doctor if you have any concerns. As the name suggests, they work best for inflammatory pain, things like muscle injuries, period pain, arthritis, and other inflammatory conditions. There are a bunch of different NSAIDs. We usually start with the gentler ones and then work our way up if needed, because the stronger they are, the higher the risk of side effects, which is mainly stomach irritation. But if you notice any concerning symptoms, stop the medication and speak to your doctor. Which brings us to morphine. It has a bad reputation now, and for a good reason. But when it first appeared, it was a game changer. Here's how it works. When your body's injured, pain signals travel along the nerves up to the brain, and pain is basically this conversation between the body and the brain. Opioids step into that conversation by sticking into these special docking sites on those nerves called opioid receptors, and that makes it harder for the pain signals to travel. So by the time it reaches the brain, it feels much less intense. And they don't just reduce pain, they can also make you feel calm, relaxed and happy. And the problem is your body's really clever. Over time it just gets used to that effect and it starts to compensate, meaning you need more to get the same result. And that's where a huge problem with opioids rise. You get tolerance and you get addiction. So it is in your best interest to have a doctor who's really careful about these prescriptions, because if they're not managed properly, they can cause real harm, as we've seen with the ongoing opioid crisis. They also affect the nerves in your gut, which is why side effects like constipation, nausea, and vomiting are quite common. Opioids can also make you feel drowsy or confused, which is why you're advised not to drive or operate heavy machinery while you're taking them. So, bearing all that in mind, when it comes to opioids, except in very specific situations, the goal is always to be on the lowest effective dose for the shortest possible time. And from the moment you start it, there should be a clear plan for when and how you're coming off them. That being said, opioids absolutely have a role, particularly for severe pain after serious injury, for cancer or palliative care, and sometimes when other treatments just haven't been enough. And just like with NSAIDs, you really want to start with the gentlest option first and only work your way up if needed. Which brings us to neuropathic painkillers. Now, this is a huge topic on its own, so I'm really just going to skim the surface here. These are painkillers used for nerve pain that comes from damaged or irritated nerves rather than inflammation or injury. They're particularly useful when the problem is the nerve itself, because they can help to calm overactive nerves and dampen abnormal pain signals before they even reach the brain. There are a lot of different options and they work in different places and often with other uses too, but all with the same goal: calming nerve pain. They don't typically work overnight because instead of blocking pain straight away, they gradually change how an overactive nerve behaves, and that can take time. And because they act on the nervous system, side effects like drowsiness or dizziness can be common, especially at the start. Depending on the drug, you can also get side effects like nausea, constipation, or dry mouth, so it's always worth checking the label to know what to expect. Nerve pain can feel like a burning or a shooting pain or like electrical shocks. Typical examples include diabetic nerve pain, sciatica, nerve pain after shingles, and facial nerve pain. These can take a bit of trial and error, so we typically start with the lowest dose and titrate up. So I hope running through the why, what, and how of these painkillers has been useful. There are other painkillers out there, of course, but these are the most common ones used in the community. As you can see, medicine is not perfect, but it is always evolving, and who knows what we'll be adding to the table next. This has been Medicine Made Clear with Dr. Amayo. I'll see you next time.